Hi, my name is Tanya Malik. I've been a therapist for 5 years. I trained in clinical psychology with the focus on women and feminist mental health. I've done a lot of academic research. I've been extensively published, and currently my focus is through counseling psychology in couples and relationship counseling, as well as anxiety and depression. I had a great high school teacher who pushed me towards psychology. She was a great psychology teacher. That's where my interest in the subject grew. I think that I enjoy listening to people. That's to know that there was a career path that allowed for that, and the additional benefit of being a part of the healthcare system is what drew me in. Relationship issues, anxiety, depression, work stress, family issues, all childhood things that you're wanting to re-explore, behavioral patterns in yourself that you're wanting to change. Talking about themselves, a very loose, open-ended conversation. I encourage you to take it the direction you want to take it in. I'm here to understand the things that you think are important for me to know about, be that certain behaviors, be it habits, be it your regular daily schedule, be it old things, new things, current things, things from your past. Yeah, the first session is a complete background on you. No. Come in, open mind, do explore a few therapists, see what is the best fit for you. Understand that therapy is not a one-stop solution. You're not gonna go home with a prescription pad of do this, do this, do this, and you'll be perfectly fine. It is a journey of you discovering what is fine for you and us achieving that together. I would expect if you're doing your homework by your third session, you should be coming back to me saying that, hey, here are some behaviors that I've been able to change, or here are some thought patterns that I've been able to break in whatever small or large way, and any progress is significant. But yeah, by the third session, if following what we've been talking about and in your mind reflecting on your own time, by the third session, you should start seeing some changes. My notes are private. I would say that in the case of harm to yourself or potential harm to others, so any form of suicidal ideation with an active plan made, any ideas of harming other people would be reportable. But outside of that, your notes are on my private device, on my private computer. I don't have a right or a need to share that with anybody, your family members, your employers. If anything does need to be notified, it will be done so with your consent, or at least by informing you. I of course welcome other support systems, family members, friends, etc., to be a part of the therapy experience as my client decides. And any information that needs to be shared with them will first be walked through with my client, and only then, when we have everybody's consent, do we move ahead. Exploring what about it makes them nervous or hesitant. What are their thoughts about it? What is the information they already have that they're coming in with? Are there any myths that are being perpetrated? Are there, past experiences that haven't worked out well? Again, that issue is addressed the same way any other issue is addressed. We ask questions, we hear, and we try to nail down what's going on and see how we can fix it. I create a non-judgmental zone. I encourage my clients to just point out, flag it off. This wasn't great. Come back 2 sessions later and be like, "Hey, Tanya, something you said a while ago, or I've been thinking about it. I didn't like it." That's really, really great self-advocacy. That's what we're here for. Yeah. Therapy and lifestyle will definitely go hand in hand. There is nothing that talking to people in a room or online together is going to change as much as you changing the way you're living through your days, either in your own mind or actually practically. Medication is something that some of my clients come in already taking. In the first session, depending on degree of symptomology, I may recommend speaking to a psychiatrist first, maybe doing some evaluations. It might also be something that happens and comes up a few sessions later. If we're recognizing that through our techniques, sleep is not improving, appetite is not improving, our general mobility is not improving, motivation is not coming. At that point, we would look to medication as a great alternative solution. It's not always a therapy doesn't seem to be working. Sometimes a therapist doesn't seem to be working. We all come with different backgrounds, different niche specialties, much like going to other doctors. How you go from, one specialist to another, you might end up doing that here. I myself have worked with clients for quite a while and then reached a point where it's like, okay, fine, this issue which we are just not able to crack. Maybe you need somebody else with a different point of view, and then you move on. I also have clients that have a few different types of therapists. Some might be cognitive load related, some might be trauma related, some might be general. How do I get through my life? More balanced oriented. Your team, the size of your team depends on you, and anything is great. A lot more openness to speak their mind, a lot more recognition and actually labeling some of the thoughts that they're having, finding the words to articulate how they're feeling. A lot of them being able to recognize and label their thoughts for themselves or their feelings for themselves goes a long way. I do look at a routine as a great anchor point for your mental health, and therefore, those nodes in the routine that need to be really concrete get set up, and that's always great to see. I'm really good. Um, no, I am. I have to say, I am. Conversations are always fun. Conversations are insightful. I believe that I hold space really well. Conversations can sometimes be very emotional. We don't trivialize any matters. We don't make you feel like you are wrong or you are abnormal or this should not be happening. Those might all be very fair. But while you are in the space with me, we are looking at how is your life going to get better? How are we going to make our days and weeks better? And yeah, and a little bit of insight, somebody seeing things from a different perspective, pointing out some things. Sometimes we don't even acknowledge our small wins or like our big losses. It's all about, am I reaching a certain level? Am I holding myself up to a standard? And therefore, having somebody to be able to recognize that in you and offer you validation and recognition for yourself can go a long way. That's great. That's perfectly fine. It cannot be for you, as long as you're not like discrediting the profession and the field of study. That's a separate conversation. But yeah, therapy might not be for you, in which case I would still recommend using course books, guidebooks, homework worksheets, stuff that you can find on the internet, textbooks that you can buy. It is it is a valid field of study with a lot of insight and opportunity for growth and improvement to offer. And you're welcome to do that on your own. You can follow TED Talks, YouTube videos, a lot of psychologist posts. So there's a lot of way to provide self-care or socially enabled care without going through therapy.